Dear students, I welcome you all for a very brief presentation on red flag signs in headache. I am choosing this topic because many times when you're sitting in the OPD, you don't know whether this headache is just a tension type headache or a migraine headache, and just tell the patient that okay, we'll treat with some analgesics, let us wait and see, or whether you should admit the patient and evaluate aggressively. So this confusion always exists whether you are a very beginner of the medical fraternity or a very well experienced physician. So despite most experienced situation, many physicians miss many red flag signs and end up making wrong diagnosis. So to avoid this complication, I've chosen this topic. All of you can remember red flag signs by the mnemonic SNOOP 10. SNOOP 10. So this is the mnemonic. We'll see one by one. SNOOP 10 stands for S stands for systemic symptoms. So whenever you are trying to remember these red flag signs, always imagine yourself sitting in the OPD and imagining a patient is coming to you with headache and all these red flag sign symptoms. So if a patient comes with a headache with systemic symptoms, any systemic symptoms including fever, you should never ignore. Okay, so headache with fever, photophobia, vomiting, loss of appetite, weight loss, whatever associated systemic symptoms are there, you have to always explain the patient the underlying seriousness, admit the patient and evaluate, or at least on OPD basis get the imaging done. So next, N stands for neoplasm history. Again, if a patient has got a history of neoplasm malignancy in the past and now comes with a headache, never ignore it. Always think like whether it can be recurrence of the malignancy or occult metastasis which has caused cerebral metastasis and headache. Another N in the mnemonic is neurological deficit. So any deficit like headache with seizures, headache with altered sensorium, headache with loss of consciousness, headache with ptosis, diplopia, hemiplegia, monoplegia, whatever it is, if there is a neurological deficit with headache, don't ignore it. Take it as a red flag sign and evaluate appropriately. O stands for older age, more than 50 years usually. So if anybody with the age more than 50 years, if they come with history of new onset headache, never make a primary diagnosis of tension type headache or migraine. It can be still, but never forget that they can have underlying secondary causes like joint cell arthritis or cranial or vascular pathologies. Most commonly, if anybody comes with a unilateral headache, I have seen that many physicians making a mistake of either migraine or cluster headache or tension type headache. Never miss this. So if anybody aged more than 50 years comes with a unilateral headache, jaw claudication is there, and you palpate the temporal artery, it is tender, then probably you are going with the giant cell arteritis diagnosis. Next, another O in the mnemonic is onset. Any headache which has got a sudden or abrupt onset, never ignore it. So what are the common conditions which can have sudden or abrupt onset of headache? All of you know subarachnoid hemorrhage can present as acute thunderclap headache. Another condition is RCVS, reversible cerebral vasoconstriction syndrome. So here there is a reversible cerebral vasoconstriction which will lead to cerebral ischemia and then headache. Next, P, there are 10 P's. That's the reason in the mnemonic there are 10 P's here. Snoop 10 means P10 are there. What are those? We'll see one by one. First P is pattern change. Patient tells you that I used to get headache, holocranial or bitemporal. Nowadays, I am started to experience a different site and character of the pain. It is becoming more of unilateral, very throbbing or thunderclap type. Then you need to take it very seriously. Most common cause for a pattern change is the neoplasm or vascular etiology. Next P is position change. Headache with any positional change, you have to think of secondary causes, especially idiopathic intracranial hypotension or idiopathic intracranial hypertension. So it is hypotension or it can be hypertension. So usually these patients will complain of headache in upright position. Whereas a patient with a raised ICT, classically they will tell that they get more headache when they lie down in sleep. Okay, and usually this raised ICT will make the patient wake up from sleep. That's a very red flag sign you should never miss. You should always ask the patient, even in busy OPD, that have you ever woken up from sleep due to headache? If this history is there, it's a very red flag sign. Another P is precipitated by coughing, sneezing, exercise. Okay, usually these are by raised ICT only. Okay, next another P is papilledema. Okay, another P in the list is progressive headache. Next, pregnancy or puerperium. So very important aspect of pregnancy puerperium is that anybody with a new onset headache during pregnancy or in the puerperium, you should always evaluate for preeclampsia, CVT, very important, CVT, because the line of management for the CVT is very different from all other headaches. Then post-dural puncture headache. Why post-dural puncture headache? Many patients with the LSS, they undergo spinal anesthesia or epidural analgesia and they end up presenting with post-dural puncture headache. Apart from these, some of the common factors like anemia, diabetes mellitus, hypothyroidism are also contributing factors for headache in pregnancy. Next, painful eye with autonomic symptoms. Okay, so what are the causes for this? TAX means trigeminal autonomic cephalalgias. Next, any pituitary pathologies also will present with cranial autonomic symptoms. So cavernous sinus lesions also. Then rule out Tolosa-Hunt syndrome also. Tolosa-Hunt syndrome, which is an inflammatory condition of the orbit. Then certain ophthalmological causes also can have painful eye with a headache. Next, another P is post-traumatic onset of headache. After history of trauma, if anybody complains of headache, they would have many times you would have seen patient coming and telling that I had history of fall, head injury 3 months ago. Now since then I'm experiencing pain. It is becoming more and more worse day by day. Never ignore it. You can't tell that you had trauma that time, now you can't do anything or you can't evaluate. You should always evaluate this. So another P is pathology of the immune system. So classically HIV or patients on chemotherapy, patients with CKD, patients with immunosuppressive therapies. So all these patients, if they complain of headache, never ignore. So many times a silent infections like TBM, cryptococcal, or Kaposi sarcoma, all these things can just present with just headache. So have a very low threshold for secondary causes in HIV patients when they come with headache. Next, last P is a painkiller associated headache. Here, patients are so much used to taking painkillers or medications and they become dependent on it. The moment they reduce the dose or stop it, they develop headache. This is called as medication overuse headache. Medication overuse headache. So here classically they will tell that they have to take the tablet, otherwise they start developing headache. So when they get up in the morning, when the drug effect is not there, so they develop headache, and once they take it, they'll be better. So chronically they are dependent on it. So this is called as medication overuse headache. So to quickly revise, red flag signs in headache, the mnemonic is SNOOP10. S stands for systemic symptoms, including fever, you should not ignore. Then N stands for neoplasm history, another N stands for neurological deficit, O stands for older age, more than 50 years, then onset, sudden or abrupt onset, then P's, 10 P's are there. What are those? Pattern change, then position change, precipitated by coughing, sneezing, or exercise, then papilledema, progressive headache, pregnancy or puerperium associated headache, painful eye with autonomic symptoms, then post traumatic onset of headache, pathology of the immune system like HIV patients with headache, painkiller associated headache, also called medication overuse headache. So, in short, this is about red flag signs in headache. Hope this brief lecture is useful in your day-to-day practice. Thank you.